All right, Shirley. So tell me what is going on with your feet?
They feel tight on top,
Uh-huh.
and they'll ache after they're at rest for a while.
So they feel tight and they ache
On top.
on top. What do you mean by aching? Can you elaborate?
They'll hurt in here. They feel very tight, like something's pulling and tightening up, and I can't.
How bad is it? How severe is it?
eh, I have to wait to walk a little bit,
Uh-huh.
a few steps when it's really bad, and I can't stand my jeans or something to touch the top. It nerves when it hits. It's just like, get those off there.
So what happens when your jeans touches the top of your feet? What feeling do you have?
Like little pins or something on there. And so I turn my jeans up so they won't touch.
All right.
Yeah, it's just like little needles on top when they touch.
And so, since when this has been going on?
Oh, quite a while. It's just gotten worse. That's all. It's been
Quite a while,
like a
several
year.
months or
like
years?
a year or two, yeah.
A year or two?
But it's gotten a lot worse.
All right. And so, when does it bother you? Does it bother you all the time or in certain times?
It bothers me whenever I've got my feet at rest, like when I wake up in the morning, or if I'm sitting in church or something for a while and then stand on them. That's when it hurts.
So it bothers you when you are when you first get up in the morning and when you are sitting. Does it bother you when you are up on your feet and walking?
Not after they get stretched good.
Then it doesn't bother you.
It doesn't.
Does it bother you if you keep on walking around?
No, as long as my feet are moving, I'm okay. As long as
So it bothers you more after you've been sitting for a while.
right.
Is it
when
right?
I have to stand on them after I'm sitting for a while.
All right. Okay. So have you done anything for it?
No.
Okay. And it is, as I understand, is it in both feet or one feet is more than the
It's
other?
mainly on the left foot, but it does happen in both. But it's mainly on the left.
Mainly
foot.
on the left. And when it does hurt, can you tell me on a scale of 0 to 10 how severe the pain is?
Gosh, I don't know. I'm not good at that.
Or is it mild, moderate, or severe?
It's, I would say moderate, but it a little more than that. It hurts. You just can't. You're limp. You can't walk without limping on it.
Right.
It hurts bad enough.
And so for how long the pain is there?
Oh,
After you've been sitting for a while and when you get up, for how many minutes or
Maybe-
do you experience?
maybe 5-6 minutes.
5-6 minutes.
Maybe a little longer. It depends on.
So 5 to 10 minutes and then it
Yeah.
disappears.
And then it begins to loosen up again. It
All
feels-
right. How
feels
long?
like it's stretched.
So this has been going on for a couple of years maybe, and recently over the last few months it has gotten worse.
It's gotten worse.
Right. And do you have any back pain?
No, not that I know of.
No back pain. Do you have stiffness in your legs?
No.
Okay. So let me start off with here. Let's see your feet. If I, just a rough estimate, if I touch, can you close your eyes? If I touch your feet here and here, is there any difference?
No.
You feel the
I
same?
feel both of them.
And what about here and here?
I can feel your touch. I don't feel that much different. A little more sensitive on the bottom, but.
But the feeling is the same. And the burning sensation, again, it is temporary. It doesn't stay once you have been
it's
out.
just temporary.
Okay.
Once they get,
All right.
once I get them stretched out.
So, you know what I'll do? I'll first do a McKenzie intervention. I'll start off with your back and see if that will make an impact. And if it doesn't, then we'll move further. We'll do further assessment. But right now, because both feet are involved, and by the fact that it is intermittent and it tends to bother you after you've been sitting for a while, I'm getting suspicious if the symptoms in your feet are coming from your back. And I know you are not having any back pain, but let's work on the back and then we'll see.
Okay.
So right now, are you having any symptoms?
No.
No, none
Not
whatsoever.
while I'm, no.
So it will be difficult surely to assess the response today itself during this visit. So in this scenario, what we will do is I'll send you home with some basic exercise and some posture correction.
Okay.
And then next week we'll see you. You will do those exercises during the week and we'll see if that is making any impact.
Good.
Because you're not having any pain right now, I cannot assess a response today itself. I would like to like you to sit up as straight as much as you can. Do you see what I'm talking about? And I know you have got a lot of curvature you have developed, but see if you can sit up straight. That will help. Okay?
Okay.
So you will sit up in a straight chair. So let's see if you can raise the whole top part of your body.
Like this?
Yes. Right. How do you know that?
It just does. It doesn't hurt.
Wonderful. All right, come down. Let's go up. Let's do 10 of these movements.
Okay. You want 10 now?
Yeah. So you will do this, we call it back stretches in lying. I would like you to do 20 reps 4 or 5 times a day if you can.
Okay.
Very good. And now come up straight. And then stretch as much as you can. And now come up straight. So that's what I would like you to do.
Okay.
These 2 exercises, do it 5 times a day. Call me if you are having some severe pain in your legs or if anything new is happening. Otherwise, I'll see you in a week.
Okay.
And then we are going to assess if the back exercises and your posture is affecting your feet.
Okay.
All right?
All
Okay.
right. That is not so bad.
Yeah, not so bad. Shirley, you are here after a week
Yes.
for your symptoms in your both feet. You were having numbness and tingling on top of your both feet going on for last 2 to 3 years.
Yes.
And it was bothering you every day, right?
Yes.
So last week I sent you home to sit upright and I gave you 2 back exercises.
Yes.
And so you are here after a week. So tell me where we are today.
This foot doesn't hurt.
Uh-huh.
This one hurts a little,
Uh-huh.
but it's not nearly as bad as it was.
Okay.
And I've done your exercise.
How often did you do the exercises?
Well, I tried. 5 was about out. I had too much company in the garden. But
Uh-huh.
4 times, I could usually get 4 times.
Oh wow, so you did do it 4
I
times.
did tried to do it 4 times. There might
So-
have been a time or 2 that I didn't make it, but
Right. So did you do the lying one on your tummy?
yes, like the sit-up
Right.
or push-ups.
Push-ups, and
And
you
the-
did the
The back bend was easy
right.
because I could do that any place I was.
Exactly.
Hmm.
So how many repetitions did you do?
You said 20.
Right.
And on the push-ups, I would do 10, take a little break, and go ahead and finish with another 10.
And you also said when your jeans rub against the top of your feet, like they used to bother you a lot.
It still bothers me. The jeans will still bother, especially this foot.
Okay.
And this one I have pain in, but this one is okay.
Let me verify your technique, how you are doing. Since we have gotten a positive response, I'm going to work more on your back
Okay.
because we have already seen a response. So what that is telling us is that the feet issue was coming from your back.
That's strange.
That surprises you, right?
Mhm.
Well, that can happen as you see. Like we didn't touch on your feet, right?
No,
We just worked on your back.
on the back.
So I just want to see how your technique is and then we'll work more on your back and we'll see if we can take away the remaining discomfort in your left foot.
Okay.
All right. So show me, Shirley. Can you stand up and show me how you are doing the back bends
Okay.
on standing?
I did it right. And I went back as far as I could, probably. It didn't hurt.
You're doing it very good. I'm so impressed by you.
That was
And how old are you? 81?
81.
Oh my goodness. When you go all the way up,
Okay.
go all the way up, lock your elbows, and now sag, relax. So yes,
Okay.
so that the tummy goes down.
Okay.
Were you doing that at home?
No, it wasn't. I
Yeah,
was
that's how I want
going
you to
up
do.
like-
Okay, when you go up, Shirley, keep your look upwards. Make a smooth curve, yes, in your spine. We will do a few more. So let's give it a try for a week more. and we'll see if the remainder of the pain in your foot gets better or not. Hi Shirley.
Hello.
So this is the third time I'm seeing you for the same problem.
Yes.
At a week interval. This is visit number 3. Tell me how you are doing.
The pain's gone.
The left foot pain is
Yes,
gone.
it's gone. Both feet are fine.
There's no more pain.
No.
Are you surprised that the back exercises took care of your foot
Yeah,
pain?
I am. I didn't think that would work, but it did.
Yeah. Good, good. So anything else you have noticed since you have been doing the back exercises?
Well, your back feels better
In what way does it feel better?
because you're more limber in your back. I think the back bends have really helped.
In what way? What other way has it helped apart from your feet?
Well, it's easier to move. It's
Mhm.
easier to go with the back.
So you do a lot of gardening, right?
Right.
Has it made a difference in what you do on your day-to-day life after doing the exercises?
Yeah, it has.
In what way?
Well, it just feels better. You're able to bend better, move better.
All right. So Shirley, this is the roll.
Mm-hmm.
I want you to sit in a upright chair like this, and you will slide your buttocks all the way to the end of the chair, lean forward, and just above the waistline you will use this pillow. And this will help you sit upright.
Mm-hmm.
Do you feel it is?
Mm-hmm. Yes.
So it will prevent you from slouching and getting rid of that, that
Right
will maintain
here.
that hollow in your lower back. And that is good for your spine. It helps you sit upright, and that's what was causing the foot pain. And now the foot pain is, as you can see, you are doing better with that. So,
This would help.
and you look so much younger, Shirley, sitting upright.
Okay.
You don't look it communicates a total different persona of you.
Mhm.
Do you feel like that or no?
It feels better. It really
Yeah.
does.
Yeah.